Hi, my name's Dr. Aye, and I'm a board-certified ophthalmologist. Welcome to this channel.
Today I'm going to teach you about quite a common but a scary looking eye complaint. If we look closer though, it is benign and it's not a totally worrisome condition. It can be tiny as a small red blob over the white of the eye or a big splash of red that covers the entire white of the eye, which makes you look like a character of a horror movie. We call this subconjunctival bleed or subconjunctival hemorrhage. But again, it is benign and it is nothing to be afraid of. So I'm gonna tell you why, and maybe after this video you can even manage this yourself at home. So what is subconjunctival hemorrhage? Subconj hemorrhage is bleeding resulting from a break in a small blood vessel in the eye. The bleeding appears a very bright red, but it is sandwiched between two transparent layers over the white of the eye. It will not run off your cheeks like flowing blood, or will it mix with your tears. It may, however, start off small, then later on spread to involve a larger portion of the white of the eye. But I assure you that it will not spread farther than the whites of the eye. Are you wondering if it's painful? Generally, there is no pain. In my over a decade of practice as an eye doctor, I have yet to hear of pain in this type of bleeding. Occasionally though, the eye may feel dry or rough or scratchy, but your vision will not be affected.
So why does the eye bleed? The causes and the risk factors for subconjunctival hemorrhage is varied. In some of these, you'll be surprised what could make small blood vessels break. Simple everyday things like coughing, sneezing, or straining to poop may break blood vessels, especially in someone who also has old age, diabetes, hypertension, or is taking blood thinners like aspirin. Other activities like, say for example, heavy lifting, pushing big stuff, diving, or aircraft ascent can also lead to bleeding. Trauma to the eye from scratching or contact lens wear injury can also lead to a bleed. It may also result from head trauma, as in from a car accident, or birth trauma, or choking or vomiting. It may also be linked to other diseases like conjunctivitis or pink eye, blood disorders, bleeding tendencies, scurvy, vitamin C deficiency, or leptospirosis.
So how do we manage it? Subconjunctival hemorrhage is self-limiting, which means that it will go away on its own after a few days or weeks depending on its initial size. Call us if the blood doesn't go away in 2 to 3 weeks, or if you also have pain or vision problems, or if you have more than one subconjunctival hemorrhage, or if the blood is anywhere inside the colored part of your eye you call the iris. Vision is usually not affected, but we want to perform some simple tests to be sure. Now, you can place some artificial tears to help you with any irritation. To relieve any discomfort from swelling and to prevent additional bleed, we may apply cold compress several times a day of the first day or two. After a few days, then you can apply warm compress several times a day to aid in the healing process and blood circulation. Although subconjunctival bleed occurs commonly and oftentimes spontaneously, it is prudent to avoid the risk factors. Aspirin may be discontinued temporarily, but smoking may be stopped permanently. You will do your eyes a great favor if you do so. So that's it for today, and hope to see you again in my future video.